Welcome, everyone, to our May webinar. My name is Kathy Nickham. I'm the Education Director for the DPC Ed Center. And we're going to go over just a couple of housekeeping tools that we need to talk about before we get started. Your lines are all muted. You can unmute, though, at the end of the presentation by hitting #6 to ask any questions, and then mute your phone back by hitting *6. Or you can ask your questions through the chat box throughout the program. You'll receive the link to the recording, the slides, and any handouts that we have related to children and the topic of the psychosocial issues that happen. And we will have those probably out to you sometime next week. We also ask that you complete the feedback form at the end of the program. Your input and information to us is extremely helpful. For the past few years, we've partnered with the American Psychological Association to present an educational webinar every year during the Mental Health Month. And we value this partnership a lot and the expertise of their psychologists, and it's just been a great joy working with them. Today we have Jewel Edwards-Ashman, the Member Communication Manager for APA, and she is going to introduce our speaker for us. Jewel?
Hi, everyone. Thank you so much, Kathy. I'm really excited to introduce the presenter for this year's joint webinar. Dr. Amy Walters is a clinical psychologist with more than 20 years of experience working in clinical and community settings with children and adults. She works on helping her patients learn to cope with chronic illness and address the mental health issues, including anxiety and depression, that often coincide with diabetes, disease, and other chronic conditions. Dr. Walters is the Director of Behavioral Health Services at the St. Luke's Humphreys Diabetes Center in Boise, Idaho, and she's been the staff psychologist for Camp Hodia, a residential camp for kids with diabetes, for 20 years. She also has a daughter with type 1 diabetes. Thank you so much, Dr. Walters, for joining us today. I can't wait to hear your presentation. So with that said, I'll let you take it away.
Thank you so much, and welcome everyone. I'm so glad to be joining you and excited to be able to talk with you today about how psychosocial factors affect our kids with chronic health conditions. I'm happy to take questions throughout the presentation. You can certainly list those in the chat box, and I'll respond to them as they come up. We'll also save some time at the end of the presentation for additional questions. So in terms of our objectives today for our talk, I would like to be able to identify for you and talk a little bit about how kind of the psychosocial factors are going to impact chronic health conditions in children. I'll describe some of the common developmental tasks and the impact this has on chronic conditions. We'll discuss the impact of chronic conditions on the family. And identify some key areas of concern that families report to me during my clinical work and as well as have been found in the literature. And then we'll discuss some different ways that we can support our kids and families who are coping with these chronic health issues. As far as disclosures go, financial disclosures are the big donut. And I love this picture because here at the Diabetes Center, we don't get to see donuts very often. So I don't have any financial disclosures to report. The other disclosure that I like to talk about is just the lens that I bring to the presentation. So everyone, based on their life experiences, has kind of a different perspective. And so I'm going to talk with you a minute here about kind of my background and my take on things and the lens that I look through. So I grew up in a family with a brother who had a chronic health condition. He experienced seizures. And so had the experience of being a sibling and watching the impact that that had on my family. I became a psychologist who was very interested in working with children and families, and especially children and families who were dealing with chronic disease. I had twins who happened to be premature and low birth weight, so as a mom, started to experience what that was like. When one of my daughters turned 1, she actually developed type 1 diabetes, so we were then dealing with that. As she has progressed in her development, she has continued to have a number of additional health issues. We have struggled with chronic migraine for a number of years, and last year she was diagnosed with POTS, which is an autonomic nervous system disorder. Her twin sister has gone on to also develop migraines and GI symptoms, and I now have, just as of yesterday, a son who was diagnosed with celiac disease. So I talk with you today in my role as a psychologist, but I also talk with you from my perspective as a mother and a sister of someone who had seizures and chronic health issues. So I'll try to share those stories throughout the presentation today, and hopefully that will make it more interesting and bring some of these points home. So because in so many of my talks I talk about my daughter Sophie, I finally decided I might as well just show you who she is. So when you see these pictures, hopefully you get a sense of that. Sophie is a character. She is a very spirited 16-year-old girl who loves animals, who has a great sense of humor, who is a complete foodie, and is very close with her twin sister. She also has been able to embrace the fact that she has diabetes and oftentimes will wear shirts about that. One of the pictures in the upper right-hand corner shows her at a concert. Everyone else had their phones that they were using for lights, and she was using her insulin pump. So that tells you a little bit about her. But she's also a girl who's had to make and face a lot of different challenges and make difficult decisions when it comes to doing what's best for her health versus doing what's best for her social life, and has had to miss out at times because of that. So again, I'll be using her as a reference through our talk today and kind of sharing with you some of my own personal experiences, as well as experiences I've had in my role as a psychologist with working with families with kids with various health conditions. So children in chronic disease, approximately 20 to 30% of children are affected with some kind of chronic health condition. And we can use the word chronic condition, disease, illness. I typically tend to prefer chronic conditions because many kids with our conditions don't always feel ill, so that doesn't always kind of reflect where they are. And disease has a number of kind of scary and negative connotations. So when I'm talking with kids and families, we talk about chronic conditions. One of the things we've seen is that the rates of chronic conditions in children have really increased over the last decade, and there's a lot of discussion and theory about why that may be the case. Some evidence points to environmental factors, carcinogens, various issues with pesticides, and a multitude of other factors. But we are seeing this because of some of the advances in medical technology. We've seen a decline in mortality, and especially when we talk about children who are premature, for example, we're now saving babies who once had a very limited lifespan. So as a result, some of our kids are now living much longer lives, but are having some of the chronic conditions that can go along with that. Our definition of chronic condition or chronic disease is a condition that threatens health and development and requires some kind of special medical treatment or services. It may last throughout the person's lifetime, but we may see the frequency and severity of symptoms change, and we definitely see that with conditions like POTS, allergies, asthma. Those are conditions where we may have periods where things are very symptomatic, and then we may have periods where things are more quiet. Some examples of chronic health conditions in children are things like asthma, allergies, cancer, chronic kidney disease, cystic fibrosis, diabetes, HIV, and even some mental health conditions tend to be lifelong in nature. Our children who struggle with autism and bipolar disorder, some forms of depression and anxiety can really be quite long-term. So the information that I'll be sharing with you today will be relevant for children across disease states. I'll try to use some specific examples as I've experienced in my practice. I have had some limited exposure to children who are struggling with chronic kidney disease, so you can help me there by being willing to ask questions and kind of share your stories as well. So let's start by talking just a little bit about the psychological impact of chronic conditions. First of all, we know, and I've learned this through working with a number of families, the psychosocial factors are just incredibly common and very prominent treatment issues. And I use the word psychosocial meaning psychological, so internal to that person, but then also the social interaction piece. Many patients that I work with will talk about having lifelong issues with depression, anxiety, feeling isolated socially, struggling with feeling this hopelessness and helplessness and kind of ineffective at times in being able to meet the demands of their disease. And we definitely see this in patients with diabetes. Because I've been working in this field for 20 years, I've had the privilege of working with some individuals kind of throughout that lifespan, helping them move from childhood diagnosis through adolescence and into early adulthood, and have definitely seen kind of this waxing and waning of different symptoms at different times. Patients report to me these daily struggles of trying to balance the demands of their illness with the demands of social life and kind of emotional needs and family and even jobs, because that becomes a challenge as our kids move into that young adult life. Some feel like their chronic conditions rule their lives and define them as a person. And definitely we see this negative impact on quality of life. The other topic that I'm going to spend a little bit of time talking about is this issue of adherence, which is kind of how well you're sticking to your medical regimen or your doctor's recommendations, because this is a significant issue for anybody who deals with chronic conditions and definitely has some pretty significant emotional and behavioral underpinnings. So why do we see these psychosocial issues? Why does this happen? Well, when you think about a day in the life of a child who has some kind of chronic health condition, you know, all day long they're hearing from multiple people, whether it's family or friends or teachers or nurses, you know, did you take your medicine? Do your treatments? It's time to go to the doctor again. What did you eat? How much did you eat? You know you're not supposed to eat that. You need to eat more of this. You need to eat less of this. No, you can't have that. No, you can't do that. I know other kids do it, but they don't have fill in the blank. Kidney disease, diabetes, HIV, any of the above. So there's this constant barrage of all of these messages. So not only are our children dealing with the challenges of growing up and the developmental challenges that other kids face, but they also have this litany of pressures and questions and obligations that other kids aren't having to deal with. And this creates a high degree of stress and a high psychological impact. As I mentioned, adherence is a very common problem. This is how precisely are we following our medical regimen, these directions that our great providers, doctors, nurses, educators, dietitians, physical therapists, respiratory therapists have given us. And the truth of the matter is, typically people do not do very well. When we look at research on this issue, most chronic conditions have an adherence rate of about 50%, which means only about half the time are people doing what they've been asked to do. And if you question this statistic, I would ask you to think about the last time that you had to take an antibiotic. Maybe you had some kind of infection and your provider asked you to take an antibiotic twice a day for 10 days. How many of you actually did it twice a day for all 10 days? Most people don't. And we're just talking about 10 days in your life, not every day of your life. So this issue with following all of these recommendations is just incredibly common. Unfortunately, families and children experience high levels of guilt when they go to provider meetings because providers have their best interests. They want them to be following their regimen as closely as possible, and people feel great feelings of guilt and shame when they aren't able to do that. So they tend to over-report their success and under-report the issues that they're experiencing. So one of the things that we've found in working with kids with chronic conditions is to really be careful to take data. And one of the things that parents can do is keep careful data, including logs, of how your kids are doing with their medical management, how often they're taking it, how often they're forgetting, are they following those guidelines. We also can look at lab data to see how well people are being consistent with things. And so those are different ways that we can get a sense of what's really happening. We know that medical adherence declines as kids get older. And if you think about kind of what factors play into that, for our children who are in an early childhood state when they're dealing with their chronic disease, parents are typically the ones who are responsible for the medical regimen and doing most of the work and are very anxious about their child's medical state, so they do pretty darn well. As children mature and go into adolescence, they start to take on more responsibility for care, and that adherence tends to go down. So why is this an issue and what's going on with this? Well, negative emotions are definitely part of this package. Part of dealing with chronic conditions and chronic disease are these feelings, these negative feelings of frustration, anger, worry, guilt, failure, sadness, this helplessness and hopelessness that can go with conditions. And those often contribute to feeling burned out or avoiding. Avoidance is a really natural phenomenon. When something is unpleasant, we don't want to think about it. We don't want to deal with it, so we avoid it. Unfortunately, for our kids who have chronic health issues, when they're avoiding following their medical regimen, it makes their health worse and it creates problems within the family. So it becomes a very important part of treatment. Common factors that contribute to adherence are things like forgetting, which is really interesting because our patients here at the Diabetes Center will say, I just forgot, and providers often get frustrated with that and will say, how can you forget? You have to do this every single day. But when you think about it, some of these regimens are happening all day, every day. So when you're testing your blood sugar 6 times a day, you feel like you're doing it all the time. And so it starts to feel like Groundhog Day, and it's like, didn't I just do that? I swear I did. Same thing with taking oral medications. I could have sworn I just took my medicine. Well, we start to lose track. So this is where tools like being able to have a log that you're actually marking off when you're taking your medications can be a great way to improve that adherence. Other issues are things like opposition and refusal during certain stages of development, during toddler years, during adolescent years. We have many more issues with kids being non-compliant because they're refusing to do their treatment. Treatments are time intensive, and that can get in the way. And we also know that the complexity of the regimen and the intensity of the regimen tends to create more issues with adherence. So if we're talking about taking one pill once a day, people generally do okay with that. But when you're talking about some of our health conditions like diabetes, cystic fibrosis, chronic kidney disease, HIV, that involve multiple steps, multiple times per day, there are just many, many, many more opportunities for error. So we tend to see more issues with adherence. So all of this then has a psychological impact. And one of those things that we see are increased rates of both depression and anxiety among our kids with chronic health conditions. Rates vary depending on condition, but in general, we see rates from about 30 to 50% of kids will experience some kind of significant anxiety or depressed episode during the course of their illness. One thing that I like to remind both parents and children is that these are normal reactions to abnormal circumstances. It's not typically part of child development to have to go to the doctor all the time, to have to take medication, to have to watch your diet, to have injections or other painful procedures. These are not typical things for kids to deal with. So of course they can create an adverse reaction like anxiety and depression. We know that early screening is critical and should be part of routine care. So here in my role at the center, We have implemented annual screenings for anxiety and depression for all of our patients. And I do a weekly screening with the patients that I see just to check where they are on these measures, because the sooner we can identify if that's developing, the sooner we can get treatment and the less impact it will have on quality of life. The issues of anxiety and depression tend to impact adherence differently. So with depression, we definitely see this linear relationship that the more depressed symptoms the individual has and the stronger the depression, the worse their adherence to their medical regimen. People lose motivation, they have a lot of fatigue, they want to spend time in bed, and that makes it hard to take care of yourself. With anxiety, it actually tends to be variable. So we find that a little bit of anxiety actually kind of helps us stay on track because we're scared of consequences. So if people are very nonchalant and have no anxiety about their health, they tend to not be as adherent. But definitely when people become very anxious, that gets in the way of good self-care. So there's that variable relationship. To shift gears a little bit, let's talk about kind of health in context. So one of the things that I always want to make a point to discuss is that when we're working with children, we always want to think about them as being part of a larger system. So that child lives within a family, who lives within a community, who's part of a greater culture. And at each level, we can have elements that either support the chronic health condition or get in the way of that condition. So as professionals and providers, it's very important for us to start looking at these different levels and help to determine what factors may be improving care and helping support care and what factors may be getting in the way, and then we can troubleshoot what to do about that. Thinking about this disease in context, so we always want to put the child first, and this is part of any kind of good disability language and disability approach. Think about what is typical for a peer who does not have this health condition. What would be typical development? And then how can we match that as closely as possible? We want to think about the child with diabetes, not a diabetic. So we don't want this to be their identity, and we want to use language that's sensitive to that. This is one part of this child's life. It is not their entire life. It is one element of their identity. It is not their entire identity. So being able to differentiate that and being careful with our language. And because this child is part of a system, we're going to see an impact with family, with peers, with school community because of the disease. So what I hope to do in this next section is go through what is typical development at different phases, early childhood, adolescence, and also elementary ages. And what are kind of common issues for anybody in that age group? And then what are some developmentally appropriate ways that we can support that child with their health condition? So early childhood, this is our period of birth through about age 5. And I show you these pictures because this is the age at which my daughter Sophie was diagnosed with diabetes. She had just had her first birthday. And the picture of the twins is the day she came home from the hospital. That was the first time she had been separated from her twin sister, and she was thrilled to have her back, and you can see that. So early childhood is a time of very rapid growth and development. When we think about children in the state that they're born versus what they look like at age 5, we've had tremendous physical changes, we've had tremendous social changes, and tremendous personality and cognitive changes. So this is something for us to take into account when we're working with children with chronic disease who are in this age level. Major developmental tasks are independence and mastery of environment. So when we think about the typical 2-year-old, they want to do it themselves. They're moving away from having to have parents do everything for them, which they did in infancy, to a point of being able to do some things on their own. And they're very interested in exploring and mastering that environment. So when we work with our kids in this early age group, it's very important that we account for kind of typical developmental tasks and try to work those into the medical regimen. One of the other factors that's important to think about is that when we have a diagnosis in infancy or early childhood, with infants and toddlers, it really has a profound effect on the parent-child relationship, because not only is the parent dealing with all the other challenges of parenting a child in this age group, but now we've got the disease state on top of it, which we need to be addressing. So it's especially important for providers to be attending to that relationship, monitoring and supporting the issues that might be occurring. So common issues that we see in our kids with chronic conditions in early childhood are things like testing limits and wanting to control. They may be refusing to cooperate with a medical regimen. When Sophie was 2, she did not want me to test her blood sugar. She wanted to do it herself, and yet she didn't quite have the manual dexterity to run a glucose meter. We can see big conflicts over food, and so for children with chronic kidney disease, diabetes, other disease states where the diet becomes very important, this can create a real conflict. We're trying to get kids to eat certain foods, and many of our toddlers have very strong preferences and don't want to try certain things. We would be trying to avoid others, and this can cause tantruming. And all of this together creates a high degree of parent stress. So how do we support this? What can we do about it? Well, one thing we can do is offer choices. For example, we can offer a range of foods that are acceptable for them to eat and let them pick which one they want. You know, we are having vegetables for dinner, but you get to choose which vegetable. We can take our kids to the store with us and show them the vegetable aisle and let them pick based on the colors or the textures or things that they're interested in. When you're trying to do a medical procedure that they don't want to do, setting a compliance window for time is a very helpful strategy. So I'm going to set the timer for 5 minutes, and before the bell rings, we need to do your shot. We need to test your blood sugar. We need to take your medication. But you choose when you want to do that. You come tell mommy when you're ready, and we'll do it, but it has to be before the bell rings. We can allow them to assist us in these tasks as they're interested. We want to work around their food preferences. So maybe we know we need to include more fruits and vegetables, but our child only eats bananas and carrots. Working with the medical team to make sure that that's okay, but most of the time, most pediatricians will tell you as long as they're getting some of those nutrients, if they want bananas every single meal, that's okay for a while. And that's just an example, but you would need to speak with your own medical professional about that. But working with and around some of those strong opinions about only certain foods, certain times is perfectly okay. We can provide toys that simulate the medical care. Children learn through play, so having age-appropriate toys that simulate some of the medical devices or medical care that they need to have can be a really important way for helping with that psychological adjustment and acceptance. I'll tell you a quick story on this one. So we had at our house a play area set up, and we had multiple doctor kits, including play glucometers and insulin pumps. And I had a call from a mom when my daughters were in kindergarten who said, I know this is a crazy question, but where do I get one of those diabetes machines? That's what my daughter Emma wants for her birthday. She said she went to Sophie's house and got to play diabetes, and it was so fun. She wants one too. So as a mother, that was heartwarming. It was no longer something that she had to feel ostracized about. It was something that was very normalized with another child, so much so that they wanted to play that game at their house. So providing those things can help create that normalization. And then, as I mentioned, we always want to support our parents and just normalize the fact that strong negative emotions are going to be common. This is really difficult work. Parenting a child with a chronic health condition is not for sissies. This is tough stuff, and so we always want to be encouraging and supporting and working with our parents. So now we move on to elementary. I picked these photos. One, kids with diabetes typically need to avoid sugar, and this was a picture that was on my cell phone. Selfie was a kid who always loved to take selfies, and apparently this is a time she had gotten a candy bar from somewhere and taken a picture of it, and you can see the excitement on her face. We also tend to see more of the mood issues start to come up in this age group, which you can see on the picture on the far right, where she was not at all pleased that I was taking her photo. I will, just a quick caveat, I did get her permission to use all of these photos. She did review them ahead of time, so we had full consent. So our major developmental tasks with elementary school age are, first of all, separating from parents. This is a time when kids are starting to go outside the home. They're spending more time with friends, they're going to school, they're having sleepovers, they're spending time with grandparents, they're not always right in our control. And for a child who has chronic health issues, especially one with a very complex medical regimen, this can create a whole host of problems to solve, as well as a great degree of stress for parents. Kids this age are starting to really develop skills, and school is becoming more important. For some of our kids with some conditions like chronic kidney disease, like diabetes, there may be cognitive effects of the disease, and so we need to be aware of that and watching for that and assessing for that. As I mentioned, the school transition is big. They're starting to develop close friendships, and we don't want the disease state to get in the way of that. And they're also starting to develop this capacity to compare themselves to others. And they're starting to work on identity, who they are as a person. And so what does this disease state mean to them? Common issues that we see among our children with chronic conditions, this school transition is huge. This is a significant source of stress and anxiety for many parents. One of the most important interventions you can do for kids in this elementary age is have early meetings with the school where parents are meeting with the teacher, school administration, and the nurse to talk about the child, to talk about strengths and weaknesses, to talk about needs, to help the school staff understand the disease state. I also highly recommend at the elementary level going into the classroom and providing education to the class about the disease state. So this can be done by parents. This can be done by a school nurse. Different districts have different policies around this, but definitely some kind of education for the other students really helps normalize the condition. It helps divert questions. And kids in our era are used to hearing about this. More and more children are coming to school with severe allergies. And so they have to provide education in the classroom so everybody knows and can be safe. And again, it just takes a lot of the questions away and a lot of the stigma away. Most elementary school kids are pretty open to ideas, and once they learn about it, they move on. Another big challenge for kids and parents are social events. So birthday parties, sleepovers, field trips, going on activities with grandparents. For kids who have chronic health issues, these create new challenges. So we have to start to identify what are the things that we would need to problem solve. What can we do to allow our children to do these age-appropriate activities, but in a safe way? From my own experiences, parties were a big one. We had several friends who had kids with allergies. There was another little girl who actually had cancer and had severe dietary restrictions, and I was the diabetes mom. And so we would all go to all of the parties and kind of hang out in the corner and chat with each other and be available as needed to administer medication, help with dietary provisions, just provide support that way. Sleepovers can be a real challenge. I'll give you another story here. So we see this a lot for our kids with diabetes, where low blood sugars in the night are a real issue, and it's a scary responsibility for parents. Because my daughters were twins, they were both invited in the 3rd grade to a birthday party at a friend's house. I called the mom ahead of time, like weeks ahead, and talked about it and said, "Are you sure you're okay with this?" And she said, "Oh, yes, I'm sure." I went a week ahead and provided her with education about diabetes. We talked about what it would look like and what she would need to do, how to make sure Sophie was safe. I had my cell phone available. my anxiety was building as the day was approaching. Sophie's anxiety was building. We went to the sleepover. I stayed the first 30 minutes to make sure everything was okay. The mom assured me we were good to go. I went back home. About 11:30 that night, I got a phone call from the mom in tears saying she was having terrible anxiety that something bad was going to happen and I needed to come and pick up my daughter. This placed me in a very difficult position because she had a twin sister and I needed to decide, oh my gosh, do I pick them both up and then create this sibling conflict and resentment? What do we do here? So in this situation, I just asked the mom, do you happen to have a couch I can sleep on? And she said, sure. So I went and joined the sleepover and everything worked out. Not to say that's how it should always go, but that's just an example of some of the challenges that come up for parents with kids with chronic conditions. Other common issues in our elementary school age kids are things like self-esteem. They're starting to compare themselves with peers. They're starting to notice that, gosh, not everybody has to wear this medical device. Not everybody else has to test their blood sugar. Not everybody else has to take medication at lunch. Not everybody else leaves all the time to go to doctor's appointments. So helping problem solve those issues, helping develop esteem in other areas, helping our kids to know, how do you react when a peer asks questions? Sometimes just practicing, what do you say to certain questions? What questions are you most nervous or afraid of? And how can you react to that in a way that helps your friends understand, learning how much information to share, what kind of information to share, and when to share it are all really important skills. And then we want to help our kids learn to develop responsibility for self-care, so starting to involve them in some of these activities. So how do we provide support for our elementary school age kids? I've given you a few examples already. Definitely increasing their involvement, sharing information, having some kind of a written care plan to facilitate care by others is critical. So I would actually write out a bulleted list for babysitters, for grandparents, for going to friends' houses, and you just share this with those individuals. This is my child's health condition. This is the support that he or she will need when she's at your house. If you have questions, this is what who you can call. If there's an emergency, this is what we need to do. It doesn't have to be a novel. It can be a one-page bulleted sheet, but providing that education up front really helps ease that transition for our kids when they're going to other people's homes and being with someone other than parents. Having a similar school plan with the school nurse is also very important. As a general guideline, we really want to encourage full participation in age-appropriate activities as possible and with as few restrictions as possible. There may be times we need to make adaptations or adjustments to that. For example, dietary situations. If our kids can have a little sugar but not too much, we may want to talk about, okay, at a birthday party, there's punch and there's cookies and there's cake and there's candy. Which one of those do you want the most? Let's have that one. Or, okay, you can bring all that stuff home and then little by little throughout the week, you can have that. We're just not going to do it all at once. So ways to still engage in the activity, but with some adaptations. We want to be as flexible as possible in the regimen to help support the activities and the peer interactions. Again, always child first. Make the disease fit the child, not the child fit the disease. That's from a psychological perspective. And with that, I'm going to give you a quick caveat. We do team-based care here at the Diabetes Center, and it's very interesting when we have professionals from multiple disciplines, including our dietitian, psychologist, and physician, because we can all look at the same situation, and what the psychologist thinks is best may be different than what the dietitian thinks is best, and that may be different from what the physician thinks is best. Sometimes they align very nicely, sometimes they do not. So as a parent, you may be faced with making a choice. There may be times when going with what's in the medical best interest makes sense, but there may be times when going in what the psychological best interest is makes sense. And you have to look at your own comfort zone and work with your team to make those decisions. So let's talk for a minute about adolescence. This is a very challenging age for our kids with chronic health issues. And here I want to poke, the reason I chose the pictures I did, on the far left, that's actually the Sawtooth Mountains here in Idaho, and that's diabetes camp. If you have opportunities to do camps around your chronic disease state, I definitely encourage you to do this with your adolescents. This can be the best psychosocial intervention available. So we definitely have camps for kids with cancer and HIV and diabetes and some others. So look into that as an option. The second picture is a social media picture that my daughter did. Social media adds a whole nother level of peer involvement, opportunities for interaction, but also opportunities for teasing, so we want to pay attention to that. And then just recognizing that in this age group, the peers become the most important person in their life. So our major tasks in adolescence are separation and independence. These kids are getting ready to go off on their own into the world, away from their parents, and being independent. That means one thing when it comes to being financially independent, but it means a whole other thing when it comes to their disease state. So are we preparing them to understand their medications, to work one-on-one with their providers, to know how to navigate the healthcare system, to understand insurance? Those are all really important tasks we need to be working with our adolescents on. They're developing their identity and their beliefs about health, and they need to understand how their disease state is going to fit in with this. As I mentioned, friends become a primary source of support and influence. So we want to take advantage of that and be proactive and make sure that our friends are understanding the child's health issues and supporting those in a positive way. We know that limit testing, impulse control, and planning issues are frequently an issue in this age group. So not pathologizing that, recognizing that just like other kids test limits or make poor choices, our kids with chronic health issues are going to make poor choices too. Unfortunately, the consequences might be higher for them. So we just want to keep that in context. And then again, that self-care responsibility is increasing as they're spending less and less time with parents. So what are the issues that we see in our kids with chronic health conditions? Parent conflict is number one. So if you're playing Family Feud and you got to guess, ding, 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 parent conflict is right up there. Limit testing. They are going to push the limits because that's what adolescents do. Parent conflict. I put it up there 3 times because I want you to know this comes up all the time. If you're a parent of a child with chronic kidney disease and you're having battles about going to medical appointments, about lifestyle change, about medical regimen, you are not alone and your child is not abnormal. This is typical teenage development. It just takes on a whole new level of severity when we're working with chronic disease. So we have to work around that, and we need some supports for that, which we'll be talking about. Adolescents have a very here and now attitude, and this can create a real challenge when we're talking about health conditions that choices now affect quality of life later. Adolescents are not wired to think about long-term consequences. It's all about right now what's going on. So even though I know later I'm going to be sick because I ate this thing, all my friends are eating it right now, I want to look like everybody else, I'm going to make the choice to eat it right now, and that happens on a regular basis. Substance use becomes a real issue in this age group. Many, many teens are experimenting with drugs, alcohol, prescription drugs, and that may have very severe consequences on their health. So we need to be educating them and talking about this in advance so they know what the implications are for their particular chronic condition. We tend to have poor and inconsistent eating habits and sleeping habits, and we know that these are 2 factors that are really foundational for good health. So while other kids can get away with 2 hours of sleep, our kids who have chronic health conditions can't, and it really has a negative impact on them. So working with them on their eating and sleeping habits to try to maximize health there. As I mentioned previously, we see more issues with poor self-management. Adherence tends to drop, And we also see increases in depression and anxiety with this age group. This is a really common time when those issues start to come up. So what do we do about it? How do we support our adolescents? One is definitely recognizing the fact that the knowledge and skills are necessary but not sufficient. So many parents will struggle because they'll tell me, you know what, she's 16, she knows how to run her diabetes better than I do. And that may be true. Our kids in this age group may have a knowledge base about what's going on, but they don't have the judgment, reasoning, and problem solving that's often needed in order to truly be successful. So parents need to stay involved. It's fine to allow more control of self-care, especially if your child's responsible and doing well, but stay engaged, stay involved, provide that support, and be a safety net. Do regular checks to make sure that they are taking their medication, that they are making their provider appointments, that they are following their dietary guidelines. It's very helpful to train friends and have them understand the disease state as well as the basic requirements in healthcare routine. It comes and is accepted much easier from your child when a friend is saying, hey, I think you better be careful about what you're eating, or I think it's time for us to go to bed, we don't want you to get sick, rather than parents being the ones nagging. Developing clear expectations. Behavior contracting can be a great strategy. If you're struggling with your teen on these issues, talk about the concerns. Talk about ways that you can help support them, and talk about the consequences that are going to happen if they're not doing what they need to be doing. It's fine to give them some leash and let them demonstrate and show that independence, but if they're not being successful with it, it's time to shorten the leash, pull it back, and take more direction and control as a parent. When we're communicating with our teens about their health issues, it's important that we're creating in a very calm, positive tone, that we're accepting and respectful of them and their feelings about what's going on, and that we're being honest because we want them to understand the consequences of their choices. We want to really help build that self-efficacy, help them feel successful in their ability to deal with their disease state, and talk about positive health beliefs. You know, why is it important to take care of yourself? What are the benefits going to be, and how do we help support you in what you need to do? Overall, we always want to adjust the focus onto health and well-being and away from illness. So changing the language and talking about what does the child want? What is it that they need to be healthy? How can we provide appropriate support to be able to encourage that? How can we accommodate them to try and achieve those same developmental tasks that are typical of other peers? And how do we help rather than hinder? So focusing on those positive supports. When we look across the age span, we know that psychological treatments work. So including a psychologist on the treatment team can be a really important resource. I urge parents to get behavioral health consultations shortly after diagnosis so that they can start in a good place, and then as needed for future follow-ups, because different issues arise at different stages of development. And it may be that your child was adjusting really well when they were first diagnosed, and then they hit the teenage years and they start to have more difficulty. And then we can use behavioral strategies, open communication, and family-based interventions to really improve disease management. And then I often conduct routine screenings, as I mentioned. So key concepts for support. We want to empower and create self-efficacy. We want them to feel effective in what they're doing and how they manage their disease. We want to give our kids as much control as possible and as appropriate to help avoid some of those power struggles. Energy and resources are a big deal. They're often maxed out, so helping prioritize and create additional supports. We want to avoid lectures and scare tactics. They don't work. They tend to make things worse. They tend to drive anxiety, and chronic disease is scary enough. So we want to avoid the lectures and scare tactics and instead do those positive supports that I was discussing. I talked a lot throughout the presentation about normalizing. We want our kids to be and feel as normal as possible and included as possible with their same age peers. We want to put the child first and adapt as needed. Grief is an issue that's really common among all people with chronic conditions, and it could be an entire presentation in and of itself, but just be aware that grief and loss are very common, and that we always want to be building hope and taking this can-do approach, and then helping build skills as needed. So it's okay if you don't know how to cope with stress. We can teach that. So we want to look for those opportunities and create that support. In the last few minutes, I want to talk a little bit about the family and the impact that this has. And so this is my family. You see my daughter Sophie there with her twin sister, her brother, and my husband and I. The family is really the support system. This is the team that helps with the management. And so each person in the family can take on a different role. You can see here within our family, we've got kind of the good cop and insurance provider. We've got grandparent support who are the knowledge base, who provide substitute parenting as needed. Her twin sister tends to be her administrative assistant who's organizing her constantly and helping her coordinate social events. And then her younger brother tends to be kind of the distractor and the comic relief of the family when things start to get too tight and too tough. The strains of childhood chronic illness on the family are unlimited. No list of potential stressors can do justice to its prospective impact. I like this quote. It comes out of the research, and it really does paint a picture of what our families deal with. There are multiple areas of impact for chronic disease. We think most about physical impact, but there are impacts in a number of different areas. We've talked a lot about social relationships, family relationships, finances. Chronic conditions are expensive, and this has an impact on the family. It can affect family lifestyle. My husband and I, before we had children, did a lot of outdoor recreation together when we would go into the backcountry frequently. We don't do that anymore as we need to be close to a phone line. We had to kind of change the focus of our recreation activities to things that were in town, closer to hospitals, closer to medical care, and made sure that we were always in contact. It can affect work. As I mentioned in the previous slide, my husband was the insurance provider. He stayed in jobs a long time that he didn't like before the changes to healthcare on chronic conditions and pre-existing conditions. So we may see families who are in this role. And then, of course, the emotional impact with depression, anxiety, and stress that go along with it. The family impact for chronic conditions is bidirectional. The illness has a direct impact on the family, and the family has an impact on the illness and family lifestyle. So we want to be aware of this and address these factors. Families of children with chronic illness often live in a state of increased vigilance, amplified anxiety, and emotional exhaustion. And if you're looking at this crazy picture, this is me at 3 a.m. after I've been doing blood sugar checks for 2 hours. And I take the photo because it shows my gray hairs, wrinkles, and eye bags, which have definitely increased since having a child or multiple children now with chronic health issues. The good news is disease does not equal family pathology. Many families of children with chronic conditions still function very well. And we really see no statistically significant differences in family functioning just because there's a child with a chronic condition. There are some protective factors which can help: family cohesion and closeness, families' ability to express themselves and communicate about difficult issues, having low levels of conflict, and having good control of the disease state. We know that parental stress is a significant factor, and parent functioning and adjustment actually is a better predictor of child adjustment to the disease than the actual disability parameter itself. Some of the factors that are our best predictors of parent adjustment are stress levels, so parents' ability to kind of manage that stress that goes with chronic disease, having other sources of social support, having a sense of competence in their ability to deal with the disease, and then having some healthy coping strategies. We know that disease parameters and illness severity really aren't that strong predictors of outcome, but stress is. So it's important that we help our families deal with stress. I've listed here some of the issues by developmental level, and I know we're getting short on time, so I'm not going to read through all of these. We've covered many of them. I will highlight one picture, for example, showing you here the sibling relationship. So I have a 1-year-old who now has type 1 diabetes, whose diet I'm trying to restrict, and I go out of the room and come back, and her twin sister is getting her snacks out of the pantry. So there's definitely this sibling piece that has to be addressed. Siblings play a critical role in support. They also are impacted by disease. Oftentimes, other siblings will feel neglected because parents are spending so much time and energy with the child that has the chronic condition, going to medical appointments, attending to care. This can cause feelings of jealousy for all of the attention, and then that results in rebound feelings of guilt. They feel guilty that they're the healthy one. They feel guilty for being jealous because they know that that's not the right thing. So we want to make sure that we're supporting siblings, that we're talking about issues, and that we're getting them professional support as needed. Other kinds of family issues that we see, marital distress definitely goes up. Creating time for the couple is important. Looking at self-care for caregivers. Caregivers have an exhausting job, and it's critical that they're working on self-care and that they have respite available. And then our families who are in split-parent homes where there's been divorce or just for one reason or another parents are in different homes, we need to make sure that we have agreements and communication so that we have consistency with care for the child so we can be as consistent as possible and that we're a united front. We can support our care providers by remembering this acronym EASY, being realistic with expectations, adapting as needed, getting good supports in place, and then focusing on you. Self-care is okay and important. Thinking about the different areas of self-care, we want to make sure, are we having a social life? Are we attending to our spiritual needs? Are we addressing our own nutrition? Parents become so focused on making sure that their children are eating healthy and making good choices, they often neglect their own nutrition. Are parents getting out and being physically active? Are they getting sleep? That's been a tremendous issue in my family, checking blood sugars all night long. And are they having just some quiet time to themselves to reflect? Self-care is critical for the parent. It's critical for the child because as a caregiver, if you're not taking care of yourself, that's going to impact your ability to take care of your child. So our take-home points, remember to consider different developmental levels, the issues that typically come up for kids in this age group, and some of the strategies for addressing them. Know that psychosocial issues are just part of this disease package, so let's be aware of them and address them directly and have a behavioral health professional on the care team. And then we always want to put the child first, normalize and promote wellness and development. And in the end, our goal is to have a happy, healthy child and family, and this certainly is possible. And these photos were taken this spring break on a family trip to Mexico. Because of the support that our grandparents have given, we often include them in family vacations. So we have a couple of minutes left. I'm happy to take questions if people would like to unmute. I'm also happy to take questions by email after the presentation if we don't have time to address your questions. You can also type questions in the chat box.
As people are writing their questions or taking a moment to formulate a question, I want to thank you, Dr. Walters, for an excellent presentation and all the great ideas that you gave for handling some of the challenges and how to normalize. Just lots of great information there. I thank you so much for what you've shared with us today.
Oh, you're very welcome. And I do have several pages of references at the end of the presentation if you're interested.
And those will be on the slides. You can unmute your phone by #6 if you have a question, or you can always email it to us later. You can also, when you complete the feedback form at the end of this program, you can put your question on there, and we'll make sure that Dr. Walters gets it. I encourage everyone to complete the feedback form. If you would like a certificate of attendance, you need to do the form. You need to complete the webinar feedback form first. And then I'd like to encourage everyone to join us June 27th for our next webinar on vocational rehabilitation and how that affects your quality of life. I do not see any questions at this point, so I would like to thank everyone for attending. I'd like to thank APA and especially you, Dr. Walters. Thank you so much.
You're very welcome. And I hope that I was able to share something with each of you that you can take away and help with your own child or with a child that you work with who has a chronic condition.